Good morning, friends. Welcome to this elective course module on the modern medicine developed by MUHS under the aegis of National Commission for Homeopathy from New Delhi. So, I, Colonel Dr. Uday from Armed Forces Medical College, am going to run through the introduction to the modern medicine. As part of this, we are going to cover this particular topic under the following 5 SLOs. 1. To understand the concept of the modern medicine. Enumerate the key differences between traditional medicine and modern medicine, impact of modern medicine on public health and human evolution, the flip side of modern medicine. And lastly, I would pose a question to you. What would be the ideal approach after you listen to this 1 hour about how to deal with the diseases in the future? With this, let's come to the first part. How did the modern medicine start altogether? So it started way back with Hippocrates in Greece, wherein he profoundly influenced the medicine course. He spoke about the relevance of diet in the science and also spoke about the Hippocratic Oath, a code of ethics and professionalism that many new doctors still take to this day. He established the duties of the doctor as a respected field. So, the complete community started respecting doctors thereafter. Thus, he is also known as the father of the modern medicine. The second part would be the concept of the modern medicine. So when we keep saying modern medicine, what is modern medicine in the first place? The modern medicine refers to the current approach to the health care. Please mind, it's not a current approach to the diseases. We are talking about a current approach to the complete healthcare system that incorporates the scientific research, the evidence-based practices, advanced technology, specialized knowledge to diagnose and treat and to prevent diseases. It encompasses a broad range of medical disciplines, treatments, interventions, which finally end up with one common point. The common point is improved patient outcome and enhancing the overall well-being of the society or the community as a whole. The concept of modern medicine arises from some few factors. The first of the factor is we talk about the evidence-based medicine. What does that mean? Basically, the modern medicine relies on evidence-based practices, which means any decision that we take has to be researched in the past based on the scientific evidence, and this approach emphasizes the use of well-defined clinical studies, randomized controlled trials and systematic reviews, basically to inform about the medical treatments and the interventions that we do. The second part is about specializations. The modern medicine is broken down into multiple broad specialities like medicine, surgery, gynecology, dermatology, etc. etc. Now these broad specialties are again broken down into various subspecialties. So by specialization, the type of care, effective care for a particular type of subset of disease is improved over a period of time. The third part is the pharmacotherapy. The medications and drugs, they play a crucial role in the modern medicine. Now, the pharmacotherapy involves the use of pharmaceutical drugs to prevent, treat or manage diseases. They are basically given for a targeted specific conditions, providing the effective treatment options. The next parts of the modern medicine or the concept of the modern medicine arises from the 3 other aspects, that is the diagnostic techniques, the minimally invasive procedures and the personalized medicines. Now, unlike traditional medicine, the modern medicine heavily relies on diagnostic techniques. When I talk about diagnostic techniques, I'm just not talking about the blood test that you get it done. It includes ranging from laboratory based testing to imaging studies, which includes X-rays, CT scans and MRIs, to genetic testings, to various screening methods for identifying diseases at a very early stage. The second aspect is minimally invasive procedures. Gone are those days where a stomach is cut open completely for operating for an appendix. Nowadays, the era has come wherein people go through a buttonholes for laparoscopy, or in fact, the holeless procedures wherein they approach these organs for surgeries through laparoscopies, through enteroscopies, endoscopies or vaginoscopies. So most of the procedures nowadays are extremely minimally invasive, which cut down on the recovery time of the patient and does improve the overall outcome of the patient. The third part is the personalized medicine in this slide. When we talk about the personalized medicine, the difference between any other traditional medicine to the personalized medicine of modern medicine is, in personalized medicine, the target is that given individual. So the treatment, the drugs, the screening, the evaluation, everything is totally titrated to a given individual. As we all understand, one shoe does not fit all. In the same way, the concept of personalized medicine recognizes that each individual is unique. Every individual has his own identity and their health care should be tailored to their specific needs. Otherwise, you would be giving a same size of t-shirt for wearing to a child also and to an elderly also, and obviously it would be a misfit at the end of the day. So the modern medicine is, over a period of time, is totally tunneling itself or is going in the direction of personalized medicine. The other aspects or the concepts of modern medicine are telemedicine, which means the use of the technological advancements in the form of internets, mobiles, and various other devices, IT gadgets, to enhance the healthcare facilities to the far-fetched people who could not otherwise be reached. So the outreach improves, and in this whole process, it enables the patient to access a medical advice, a consultation, and follow-up care without physically visiting a hospital or a healthcare facility. Another important aspect of a modern medicine is preventive medicine. When we talk of preventive medicine, we are talking about the disease not occurring in the human beings at all. So to stop it at that particular level, one is to treat a disease once a person develops it. The second aspect is to prevent it from developing. So the preventive medicine is an integral part of a modern medicine. A multidisciplinary approach. When we spoke of specializations in the previous slide, you need to understand a crosstalk between specialities, between various subspecialties is very important, and a patient needs to be managed with specialized care but simultaneously also by a multidisciplinary approach wherein all the subspecialists, they talk to each other, they give their best inputs possible and try to give the best possible outcomes to the patients. So at the end of this first part of the module 1, I would like to say that the concepts of modern medicine are primarily evidence-based medicine, medical specialization, pharmacotherapy, the diagnostic techniques, minimally invasive procedures, personalized medicine, telemedicine, preventive medicine, and multidisciplinary approach. So these 9 components constitute the broad concepts of modern medicine. These are like those pillars on which the modern medicine, the building of the modern medicine is standing. Now these concepts collectively reflect the advancements and the principles that characterize modern medicine, enabling the healthcare professionals to give the best possible outcome to the patients. Now let's move on to part 2. Here, after you have understood about the various concepts of the modern medicine, let's try to understand the difference between the modern medicine and the traditional medicine. Now, these two have a totally distinct approach to the healthcare that differ not only in their underlying philosophies, but also the methods of treatment, the acceptance in the population with the mainstream healthcare systems. So, to understand the differences, I'll take you through the next few slides. Now, the first difference as far as the philosophy and the approach is concerned is the modern medicine, which is also known by many in our country as a Western medicine or allopathic medicine, is based on the scientific evidence, rigorous research, and a reductionist approach. Please understand, don't take it negatively. Neither are we supporting modern medicine or are we supporting traditional medicine. We are trying to differentiate them based on the current scientific evidence. So, the modern medicine definitely has what is known as a reductionist approach. It focuses primarily on diagnosing and treating diseases using pharmaceutical drugs, surgical interventions, and advanced medical technologies. Whereas the philosophy of traditional medicine, when I am talking traditional medicine, I am not only talking about homeopathy, I am talking about all traditional medicines from the indigenous healing practices to fish swimming to treat the injuries, Two, the holistic approach in the form of herbal medicines, natural remedies, lifestyle modifications, energy-based therapies, magnetic therapy. So all of them encompass traditional medicine. And what is the philosophy of all these things, which is common? They are all interconnections of mind, body and spirit. So the traditional medicine connects these three dots, the mind, the body and the spirit, and they emphasize on the natural remedies for trying to treat the individuals. So this is the first difference as far as the philosophy is concerned between the modern medicine and the traditional medicine. Now let's go to the second part, the scientific basis of it. Now as far as the scientific basis is concerned, the modern medicine takes a leap ahead of the traditional medicine. Modern medicine relies heavily on the scientific research, clinical trials and the evidence-based practices. So it is grossly rooted into this scientific approaches. We'll talk about it in the final module. What is the flip side of this also? Everything has its own flip side. So, but the aim is to provide a standardized and reproducible treatment. So even if I treat, you treat or the third person treats. In the modern medicine, because there are laid down protocols, there are laid down principles, so the reproducibility is better and you have a standardization. Now whereas traditional medicine is often based on empirical observations or anecdotes. So, in traditional medicine, as a person keeps practicing, he keeps getting better. So, the quality of care by a novice versus a person who is 20 to 30 years in the service is very different, because you accumulate the various observations, you accumulate experience, and this helps in you treating your patient better with every passing day. So they are based on one, empirical observation. Number two, ancient knowledge. So we have Charaka Susruta, so Charaka Samhita. So these are the books from which we imbibe most of the information, the cultural practices and the historical texts. While some traditional therapies have shown efficacy through scientific studies, many others lack actually a scientific evidence. Now, here there is a slight bias. Now what happens is, when we talk of scientific bias, we only talk of the textbook or the trials which are done in the West. But let me tell you, many of the cultural practices in our country are very well endorsed in the books which go ages together. So we need to put them together and bring them out as a scientific evidence over a period of time. Now the treatment modalities. The modern medicine relies on a wide range of interventions, starting from the drugs to treat, from surgeries to treat an individual, to radiation to treat cancers, and to use advanced diagnostic techniques and targeted therapies to treat the individuals. It focuses on a specific symptom, a disease or a physiological abnormality. Whereas the traditional medicine, it employs diverse treatment modalities depending on the cultural context. So if we are talking about in a Chinese technique, so we talk about traditional Chinese medicine. When we talk of Indian scenario, we talk of Ayurveda, homeopathy, Unani as parts of it. When we talk particularly in other parts of the Eastern Asia, we talk about herbal remedies or acupuncture or massage as a therapy. In certain countries, the dietary modification itself is a form of therapy. So the traditional medicine employs different treatment modalities to treat an individual. Coming to the regulation and standardization, the modern medicine, because it originated in the West, it operates mainly through a regulatory framework that includes very strict standards for the development of the drugs, for doing trials, for treating your patients. So there is a clear-cut legal or a regulatory framework in which you have to fit in. Whereas traditional medicine, it varies according to the culture, according to the country in which you are practicing. In some regions, the various countries or the governments have taken steps to create regulatory frameworks even for the traditional medicine. And one good example for this is our own country, where we do have regulatory framework even for the traditional medicine in our country. Now, integration into the healthcare systems. Modern medicine on today's date remains to be the dominant form of the healthcare in most of the developed countries, and it is integrated into the healthcare system totally. When I mean integration into the healthcare system, what do I mean? Now, a person develops a problem, an insurance company has to give him a reimbursement. The insurance company relies on what? The insurance company relies on the modern medicine. Whereas the traditional medicine is limited to the developing countries, and because of which it has not been integrated into the healthcare system alongside the modern medicine. So what has happened? The problem is many of the traditional medicines are neither reimbursed by the various insurance companies or not considered the standard of care by many legal systems, and when somebody has to represent something in the court of law, it might not stand true for a traditional medicine. So the integration of this healthcare into the complete system of the community is better with the modern medicine when compared to the traditional medicine. So, at the end of the part 2, I would like to say that the traditional medicine and modern medicine, they differ in 5 aspects. 1. Philosophy and approach. 2. Scientific basis. 3. The treatment modalities that we do. 4. The regulation and the standardization. And 5. Integration into the healthcare systems. So, it is important to note that the boundaries between the modern and the traditional medicine are not always rigid. So they are not tight compartments. There is a huge overlap between the two. And many healthcare systems are exploring the integration of the traditional medicine into the modern medicine to provide what is known as a comprehensive healthcare. And we in our country are one among the first in the world to go for an integrated system of having a modern medicine along with the traditional healthcare system. Now, let's look about the impact of modern medicine on 2 important aspects in our community. These 2 important aspects are 1. The public health, and 2. The evolution of the human being. So let me first talk to you about impact of modern medicine on the public health. So the modern medicine had a profound impact on public health by improving the healthcare outcomes, decreasing the mortality, and enhancing the overall well-being of the human being. Now, the good example, which we all had a recent experience, is the impact of modern medicine on COVID care. So, the COVID had a major problem across the world, but the modern medicine came in as a panacea to take care of the human race against COVID. So, how does the modern medicine impact the public health? So, there are few aspects based on which it improves. First is disease prevention and control. And how do we do that? So, the modern medicine places significant emphasis on preventive measures such as vaccinations, health screening, and health education. Now, the vaccinations have actually helped us to eradicate a lot of diseases. One good example, smallpox. The other one in the pipeline, poliomyelitis. So, these are the diseases which have been wiped out of the complete universe. At the same time, vaccination helps us in battling major pandemics like COVID, swine flu, avian flu, etc. Now, the second aspect is the screening. The screening programs for conditions like cancer, diabetes, cardiovascular diseases enables early detection. And if you detect a person early, you can intervene early. And if you can intervene early, the patient will improve a lot. So, thus, the health screenings can have an important role in public health. The last part is health education. Till the time the community is not educated about the various diseases, we cannot act upon it. So whatever interventions you try, till the time the community is not educated, they cannot. So the health education remains a very crucial component or the crux of the modern medicine. Now the second way in which the public health has improved using modern medicine is by newer drug discoveries. So the effective treatments by lot of new drugs which have come in. Now the drugs have come a huge way from a paracetamol pill, which is a biochemical molecule, to we nowadays have monoclonal antibodies, to targeted drugs which go only to that part and get affect the human being, or to a CAR T therapy or a T immune mediated therapies wherein we are trying to modulate the immune mechanism of the body to fight the disease. So the drug discovery has come upon a long way. The second aspect in the effective treatments, leaving about the medicine part of it, on the surgical side is, as we just spoke in the previous slides, about the minimally invasive procedures to an extent wherein you don't even need to cut open an abdomen nowadays. You put a scope, an endoscope through the esophagus, go into the stomach, from there navigate into the abdominal cavity and operate. Or you go through the vagina, through the uterus and operate that particular area. Otherwise, the things have come in such as robotic surgery, wherein the accuracy and the efficacy of the surgeons have improved quite a bit. So, the effective treatment is the second way in which the public health has improved. The third part is control of the infectious diseases. The biggest challenge to the human mankind has been infections. Now, the infections can be bacterial, viral, fungal. So, they are also organisms which are trying to thrive in this universe alongside human race, and it's always a fight between two races which goes ahead. I'm not telling you a story from one of the Star Wars, but the fact is it's not from a Hollywood movie, but it's a continuous war between these organisms and the human race, and whichever wins takes us for a toll. Now, the recent example of COVID, one single virus could take the complete world down for 3 continuous years. So, public health interventions such as sanitation practices in the form of hand hygiene, clean water supply, food safety measures can increasingly impact the contamination in the environment and thus help in controlling the infectious diseases. With age, with every passing decade, the number of years a human being survives is increasing drastically. If you take 200 years back, the average lifespan in India was around 55 years, and now we are looking at somewhere close to 75 to 80 years. And how has this increased life expectancy occurred? It has occurred because of prevention. So, preventing diseases is the first crucial way of improving the life expectancy. Second is early detection through screening methods. Third is to give prophylaxis, where you feel that a disease can be there, so start empirically starting therapy. So these are the public health patterns or the modules or the ways in which we can increase the life expectancy. Next come the technological advancements. The number of advancements that the modern medicine has, starting from a plain X-ray in 1901 to current day era, wherein you can actually detect a particular type of cancer spread, and we can also image a particular cell. So the imaging has gone from a human imaging to a cellular imaging level, from a anatomical imaging to a physiological and a functional imaging level in the form of PET scans. Next, for the laboratory testing, we have gone from the days of trying to biopsy a tissue to identify the disease to a place wherein we are talking about liquid biopsies. Circulating DNAs can be used for actually identifying the individual problems inside a human being. So the technological advancements has taken a huge leap in improving the public health. Now, the public policy making. So, when we are talking of public health policies, now we are talking about the administrative role. So, the public health is not only for the doctors, but also for the community leaders. So, in this part, there are 5 ways in which public policy can impact the health, which I have shown in on this slide, in the form of public goods, natural resources, having mandates, having direct support, having opportunities, and recruiting more number of people into the right direction. So, having good public policy making by the country can actually heavily impact the public health. The next part is health education, which I have already covered a bit in the previous slides, and health awareness. So when we talk about awareness and education as part of the modern medicine, we are not only talking about awareness about a disease, but also awareness on the nutrition, role of exercise, smoking cessation, mental health, and various other things which can have public health in outcomes. Now you think of ourselves 20 years back, how many of us were so health conscious wherein we used to mandatorily do a daily jog or a run or something. And nowadays you see in the evening, you will find people having a mobile or a Android phone strapped onto their forearm and taking runs and counting the number of steps in a day. That's a positive impact of health in the society. And when we talk about health awareness, it's also important. Nowadays, you go for any movie, you'll have either Rahul Dravid coming in or an advertisement coming of what is the relevance of smoking cessation. Or you have Akshay Kumar coming and talking about the menstrual or the female health. So these are all important aspects, and that's how we improve the health education and awareness in the country. So these are important components of modern medicine. So coming to the part 3 of this module, The modern medicine has significantly improved the public health by advancing medical knowledge, enhancing treatment options, and promoting preventive measures. It has played a crucial role in reducing the morbidity and mortality rates, increasing the life expectancy, and improving the overall well-being of the population all over the world. With this, let's go to the next part. So once we have seen how positively it is impacting the health, but at the same time, now I'll come to a very debatable topic or a complex topic. And the topic is, how does modern medicine impact human evolution? Now we all know Darwin's theory. You would have read it in your 7th, 8th, 9th classes about Darwin's theory of evolution, wherein the nature has taken this into consideration. Whatever is not fit to survive should die. But with modern medicine, when you are allowing everybody to survive, so what is happening to this natural selection process? You are allowing those people who are not fit to survive also to survive. So let's look at in the next few slides, how does modern medicine impact evolution? The first one is about the reduced natural selection pressure. Now, the modern medicine has greatly reduced the impact of natural selection on human population. Natural selection is a process by which certain traits or genetic variations, they become less and less common over a period of time in the population because they are not fit to survive. So, anybody which survives is the one which has a survival advantage or which has a reproductive advantage. So, those are the ones who are selectively, positively selected, and those which are traits or genetic abnormalities are negatively selected. In the past, the individuals with these genetic predispositions or conditions, they most probably either would not come out of the fetus would not get delivered, it would get aborted in the womb of the mother itself, or there would be a lower chances of it surviving over a certain age or going to an age to reproduce further people. But with modern medicine, we have allowed individuals with these conditions to live longer and to reproduce. And when they are reproducing the same genetic abnormalities to go into their next generation. Thus, you are acting against the natural process or the nature's process of negative selection. Now, the second aspect is about medical intervention. Now, you would find an infertility clinic in almost every street in the country. What are these people doing? I am not against those people, or I am not against assisted reproductive technologies. But we need to understand that the God oblique the nature has taken it into consideration that those with genetic disorders should not reproduce, or those people who are having a genetic disorder in the womb, that fetus should not be alive or should not be born as a child. But now you are diagnosing the genetic abnormalities in advance, you are doing in vitro fertilizations, you are doing gene editing. So, you take a scissor, you are cutting down the gene into pieces and trying to attach them together and put it into the body by using techniques like CRISPR-Cas9 technologies. And with this, what are we trying? We are playing with the genetic makeup of the human being. And this genetic makeup, modulating the genetic makeup, can be a major problem for the future generations. The third part is about antibiotic resistance. You go to any hospital on today's date, any of your relative would have got admitted to a hospital. You find the cause of death on today's date in any hospital. It is not because a person is dying because of heart attacks more or because of accidents more. It is because of infection in the hospitals or what we call as sepsis. And all these infections, they are all because of multi-drug resistant organisms. So, those organisms which have got positively selectively evaluated in the environment of multiple antibiotics, and now they are resistant to all the antibiotics. And with this, their day is not far off, wherein you will have an infection and you will not have a drug to treat them. So, the modern medicine has led to the antibiotic resistance, and this leading to a problem with evolution of the mankind. The next part is genetic testing and personalized medicine. Though in my initial few slides, I said personalized medicine is a great thing because it helps to tailor the treatment, but at the same time, it has a potential to impact the selection process of the nature. Now, genetic testing is allowing people to modulate the genetic makeup. So what was left to the nature in the past, now the human being is trying to fiddle with this natural process of genetic testing. So the modern medicine can impact the human evolution by reduced natural selection and negative selection pressures, medical interventions and assisted reproductive technologies, evolutionary impact of antibiotics leading to multi-drug resistance and vaccinations, genetic testing and personalized medicine. I can understand all these four things that I have told you are heavily debatable. If I am on the pro side of the debate, I can debate it that this is all required. If I am against, I can debate it none of them are required. But you all need to understand, it is important, very, very important for all of you to note that the impact of modern medicine on human evolution is complex and multifaceted. While some aspects may influence certain genetic traits, the overall effect on the trajectory of human evolution is very challenging to predict and likely to be influenced by numerous factors beyond just medical advancements. A human life is only for 100 years, but what we are doing in this 100 years might affect the next 1000 years. So, it is very important and we should be careful while taking each and every step. Human evolution is gradual and ongoing. It is a very complex interplay of the genetics, the environment around, the cultural factors and the social factors. And if we try to selectively modify one particular factor in this, then we can actually harm the rest of the other factors. If we really want to modify a genetic factor, we need to simultaneously at the same pace modify our environment, modify our culture, modify our social factors, which is not possible. So thus, we should not be very aggressive about trying to play around with the genetics of the human mankind. The next part would be the flip side of the modern medicine. So once you have heard how it positively impacts the public health and then you heard how it negatively impacts the human evolution, let's look about a balanced view about the flip side of the modern medicine. The first flip side is over-reliance on medication. On today's date, anybody develops a sore throat, the first thing that he does is to pop in a tablet of azithromycin. Heavy reliance on medication? Do we actually require it? We all understand the commonest cause of sore throat across world is viral in 90% of the cases which do not require antibiotic. But all of us, we go to the counter, pick up a tablet and put it in. The patience in the humans have gone down. We can't tolerate a fever, a disease, a pain or a problem even for few hours, and we are over and overly relying on the medications. With this over-reliance, what is happening? More and more side effects, more and more unintended consequences. Now, I have shown you 5 different types of adverse drug reactions in this slide in front of you. But these are those which are known to us. There might be something which is not known to us, which will only be evident 50-60 years after. Like, I'll give you one example. Thalidomide. It was a very beautiful painkiller once upon a time. And people started using thalidomide for sleep, for vomitings, for pain. But what has happened? After 10 to 15 years, they realized all the children who were born because of after a mother using thalidomide for vomiting are started having genetic abnormalities. So many a times the adverse drug reactions which are going to come, we are going to probably get it or understand it after many decades after we start using the drug. So this quick drug discovery can have its own side effect. The next part is again a debatable topic, medicalization of a normal human being. Now you go today and get your corporate health checkup from one of the big laboratory. I can guarantee you none of you will have all the reports normal. So what is happening? They are making every normal human being into a patient. It has become a business. It suits the laboratory, it suits the doctors, it suits the pharma industry, it suits the country's economy as a whole. So everybody is happy with the whole story and the individuals are happy, wow, I am getting a big corporate health checkup done. But what have you done to yourself? One side, identifying important diseases early is important. At the other side, it is also important to understand that every normal human being on today's date has been converted into a patient. So, we need to draw the thin line carefully between these two parts that where is it important to identify the diseases early and where is it important to unnecessarily identify normal human beings as abnormal. The classical examples are vitamin D. Vitamin D, in India, 95% people have a low vitamin D. Because the ranges that we use are Western based ranges. We don't know what are the ranges, correct range value for Indians. Based on that ranges, everybody starts taking supplements. You do iron studies, you do B12 studies. I am a hematologist myself. 95% people will have abnormality. But is it having an impact? People lose that connect. So, having abnormal reports is not equivalent to having a disease in place. So, that understanding is very important for us to take it forward. The next part, with the improving healthcare in the society or the modern medicine, the inequality in the people has increased. You have created the society into two broad groups. One who can afford everything, who can walk into any corporate hospital on today's date. One who can't even go to a government hospital because of lack of money to afford for transportation till the government hospital. So the divide in the society has increased because of the increasing healthcare. On an average, in India, 30% of our complete savings after the age of 50 are used for healthcare. And with this increasing cost of healthcare, increasing diagnostic techniques, the affordability for the healthcare has come down in the society. And thus, you have got two broad people, one who can afford, one who can't afford. So this inequality has worsened in the society. The next part is fragmentation and specialization in medicine. What have we done? When we told that specialization is good for getting appropriate care. If I have a problem today of swallowing or talking, I'll go to ENT specialist. I have a problem in the heart, I go to a cardiologist. But at the same time, when you go to a cardiologist, he will tell you, if you say, sir, mujhe sar dard bhi ho raha hai, if I have a headache along with, he will immediately say, no, that's not my problem, you go to a neurologist. So what have we done? We have led to a fragmentation of the medicine. So one doctor does not see you as a human being. He sees you as one organ of the body. And he says, any other problem, go to the next specialist. So this is a flip side of the modern medicine. The next part is the technological dependence. When I told you that the technology is trying to improve the human care, nowadays you put your complaints in the Google doctor will tell you what problem you have. The touch of the doctor has gone. The talking to a doctor, understanding the problem, the empathy, the soft skills, everything has gone for a 6. So, the technological dependence has led to the loss of human touch in the medicine. And please remember, the only people nowadays who do it the best is the traditional medicine. The major problem with modern medicine is a patient comes into the office, before he tells me the complaint, I write down all the treatment. And he says, I also have this problem. I said, okay, don't worry, come next time. So where is the empathy? Where is the doctor-patient relation? Everything has gone for a 6. The ethical dilemmas and the complex decision making. So the modern medicine has come to a concept of mercy killing, trying to do end of life care, the shortages of the healthcare system. So there are multiple complex issues which have creeped into the system because of the modern medicine. And the modern medicine do not have answers to most of these problems on today's date. So balancing individual anatomy, beneficence, justice, ethical principles, and putting all of them together into medical experimentation, it has become a major problem in the modern medicine. So to complete this part, I would say there are a few aspects of the modern medicine which are flip side, which includes over-reliance on medication, side effects and unintended consequences, medicalization of the normal human beings, high costs and inequalities, fragmentation and specialization, technological dependence and loss of human touch, and ethical dilemmas. We need to navigate through all these problems, get over it, and this is that place where the traditional medicine is better than the modern medicine in many of these issues, and we need to integrate both of them together to bring to a proper solution for treating patients in the future and providing the ideal health care to the community. Now, after you have heard about the positives, the negatives, the concepts of modern medicine, the impact of modern medicine on the public health, human evolution, one important question which we all listening to this should pose to ourselves. What is the ideal approach for dealing with the disease in the future? The traditional medicine also has its problem. The modern medicine also has its problem. So what is the ideal way of taking things forward? The answer is very simple. We need to understand that these are not tightly separated compartments. You don't work in silos. That means you are not in watertight compartments that the modern medicine should not integrate some parts of traditional medicine. Traditional medicine should not take the benefits of the modern medicine in the form of investigations, etc. So the ideal approach is to complement each other. And therefore, currently, we don't use the word traditional medicine and use the word complementary or alternative medicine for these other specialities that are there in the world. So, the best form is to complement them. There are many places where we do not have a treatment or a given way of managing in the modern medicine. There, the traditional medicine can actually come forward and take those parts and try to complement and make sure that we are not left with the lacunas in the system. But at the same time, relying on only one system or overtly relying on one system despite of the disadvantages occurring is not the right way to go. So the ideal way is to complement each other. So with this, I would come to the end of the presentation, and these are few books which I would like to give you for further reading. So none of them are medical textbooks per se. Half of them are novels, half of them are good to read books in the non-technical libraries, wherein you will have a good read and understand the concept of medicine or patient disease in toto. So I will encourage each one of you to go through these books. You will have both views, both positive as well as negative, both towards modern medicine and traditional medicine when you will read these. These are few of the references for which for the chapter or for the module which we have taken. And with this, I would like to end my talk by thanking both the MUHS and the National Homeopathy Commission for giving me this opportunity to discuss with you about the introduction of modern medicine. Thank you.